I start examining the basis of why I believe Lenape Valley and Bucks County are primed for genocide, and they probably don't even know they are. I want to make sure that people look at my Lenape Valley Foundation Needs to Be Shut Down playlist and watch these videos, because they paint the picture of an organization and a county that is primed for mass murder, and they don't even know it. And the problem is, the public doesn't know it either, but that changes today. So this is a summary of the Patient's Bill of Rights, and this is about the United States. And you will find that insurance companies actually fought very hard to fight for the industry reform, and basically the legal reform of the industry. And the reason why is they don't want to provide proper services. And this is one of the problems with the Healthcare Freedom Act, the Obamacare Act, is because it was a sweetheart deal to a lot of the insurance companies. And it gave the insurance companies a lot more power, and it's really not a great idea. And if you ask me, the Healthcare Freedom Act has paved the way for death panels. This is a summary of the Bipartisan Patient Protection Act, and I strongly encourage people to read this on their own. I will probably go through this in depth in a later video. This was from John Kerry, John McCain, a couple other people. It's important that you understand, once more, the government is actually, you have two camps in the government. Some of them are trying to protect the public. Some of them are trying to not protect the public. Some of them are taking kickbacks from the insurance company. Some of them are taking kickbacks from other people. Okay? But the facts are the facts are the facts. This was a good bill. Okay, the Bipartisan Patient Protection Act. And I'm going to move forward here. So if you make a claim like the mental health industry as a whole, and Lenape Valley and Bucks County in particular, are primed to commit genocide, that's quite an accusation, and you need to understand what genocide is. So the word genocide was first coined by Polish lawyer Raphael Lemkin in 1944 in his book Access Rule in Occupied Europe. It consists of the Greek prefix genos, meaning race or tribe, and the Latin suffix side, meaning killing. Genocide was first recognized as a crime under international law in 1946 by the United Nations General Assembly. It was codified as an independent crime in 1948. The definition of the crime of genocide as contained in Article 2 of the Genocide Convention was the result of a negotiating process, and reflects the compromise reached among United Nations member states in 1948 at the time. So the definition is, okay, so killing members of the group, and you will see that's what happens, causing serious bodily or mentally harm to members of the group. This is happening in mental health facilities. Deliberately inflicting on the group conditions of life calculated to bring about its physical destruction in whole or in part. Again, you will see this happening in mental health outpatient clinics and inpatient hospitals in the United States. And it is targeted towards a specific group. Imposing measures intended to prevent births. This is definitely the truth. Psychiatric medications are neurotoxins and sterilants, and I will show that. Imposing measures intended to prevent births within the group, and forcibly transferring children of the group to another group. And this has happened in the past and is happening now. And they're utilizing mental health to do this. Elements of the crime. The Genocide Convention Act establishes yada yada yada, the popular understanding. So there's a mental element, the intent to destroy. A physical element, which includes the following: killing members of the group, causing seriously bodily or mental harm, deliberately inflicting on the group conditions of life calculated to bring about its physical destruction, imposing measures intended to prevent births, and forcibly transferring children of the group to another group. So these are drugs that act as neurotoxins, aka poisons. And this is known. Don't think that your psychiatrist doesn't know this. Psychiatrists are physicians. They know that these drugs are neurotoxins. And they also know that there's no justification to give these drugs to a patient, because the side effects far outweigh the effects. The positive effects are more or less non-existent. And before I continue, I want to make sure people understand, I'm not a physician. I'm not an MD, I'm not an ND, I'm not a DO, I'm not a chiropractor, I'm not a nutritionist, I'm not a dietitian, I'm not a physical therapist, I'm not a nurse, I'm not a CNA, I'm not an LPN, I'm not an RN, and I'm not a nurse practitioner. I have no medical training. If you have a medical question or concern, consult somebody with a medical license and a medical degree. I am not such a person. But what I want to show here is you will see that the majority of these drugs that are neurotoxins, some of these drugs can be used and are used to treat medical illnesses. Now, are there alternatives that might be better? Most likely, yes. But the point is, these drugs actually do treat medical issues, such as the steroid-sparing drugs, okay? Such as immunosuppressant drugs used in organ transplants. However, tricyclic antidepressants, they don't really work too well. Okay, and you'll notice the majority of these are antidepressants, tricyclic antidepressant, tricyclic antidepressant, tricyclic antidepressant, tricyclic antidepressant, tricyclic antidepressant, tricyclic antidepressant, muscle relaxant. And you'll notice as you move on that these are mostly antidepressants and antipsychotics. And I want you to look at this on your own. These are the different drugs that are neurotoxic agents. And your doctor knows this. Okay? So keep that in mind. This is about the history of psychopharmacology. So early psychopharmacology, not often mentioned or included in the field of psychopharmacology today, are the psychoactive substances not identified as useful in modern mental health. Now, what's funny is psychiatrists are going back to these. Magic mushrooms, marijuana. And why are they going back to them? Because the other drugs don't work. These don't work either. These exasperate mental illness also. These create mental illness also. But they're going back to them because they've run out of stuff, essentially. So, lithium, blah, 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 blah. You can read this on your own, but this is about chemical signaling, pharmacological research, etc., etc., etc. This is about psychiatric medications. I want to skip right down to controversies. Professionals such as David Rosenhan, Peter Bregan, Paula Kaplan, Thomas Saz, and Stuart A. Kirk sustain that psychiatry engages in the systematic medicalization of normality, meaning they're taking normal people and saying they're sick so that they can make money off of them. More recently, these concerns have come from insiders who have worked for and promoted the American Psychiatric Association, such as Robert Spitzer and Alan Francis. Intellectuals such as Goffman, Deleuze, Rosen consider pharmacological treatment a lay religion. It's a religion. A medication is a Eucharist or just a concoction. So it's a Eucharist to these people. It's their religion. Antipsychotics have been associated with decreases in brain volume. Now you'll remember when I was talking about quercetin and the treatment, the use of quercetin in the treatment of Alzheimer's disease and depression. Quercetin encourages neurogenesis while simultaneously preventing cancer by stimulating stem cells and what's called neurogenesis. Antipsychotics do the exact opposite, okay? And they're harmful. So what about inappropriate prescribing? This is from the American Psychological Association. Writing a prescription to treat a mental health disorder is easy, but it may not always be the safest or most effective route. This is from the American Psychological Association. According to some recent studies and growing chorus of voices concerned about the rapid rise in prescription psychotropic drugs, today patients often receive psychotropic medications without being evaluated by a mental health professional. Okay, according to a study last year by Centers for Disease Control and Prevention, many Americans visit their primary care physicians. Now, what I would say is the primary care physician actually spends more time with the patient than does the psychiatrist. I would argue that. I would argue that the primary care physician, now that doesn't mean they should be prescribing these drugs that don't really help, but I would say that they understand the patient probably better than a psychiatrist does, and they have some psychiatric training in medical school. That's not their specialty, but every physician does have some ability to and legally they can diagnose and treat a mental health disorder. So this person is saying at least half of the folks who are being treated with antidepressants aren't benefiting from the active pharmacological effects of the drugs. No shit. Okay? But from a placebo effect. Now this has been proven in studies. These drugs don't really work. The use of psychotropic drugs by adult Americans increased by 22%. Psychotropic drugs are valuable tools in treating mental health disorders, supposedly, but inappropriate prescribing can cause serious harm. Of course it can. Prozac opened the floodgates. And I encourage people to read this on their own. I'm just skimming through it here. The drug industry. Health insurance reimbursements are higher and easier to obtain for drug treatment than therapy. Health insurance reimbursements are higher and easier to obtain for drug treatment than therapy. And this is why so many outpatient facilities are encouraging drug therapy, which has contributed to the increase in psychotropic drug sales and a shifting of psychiatry towards psychopharmacology. So it has shifted psychiatry towards psychopharmacology, says Daniel Carlott, MD. The pharmaceutical industry has been very successful in marketing psychotropic drugs to physicians and the public from 1996 to 2005. They've tripled their spending on marketing, including a 5-fold increase in direct-to-consumer advertising. The rise of antipsychotics. The second-generation antipsychotics nearly tripled from 1995 to 2008 in the U.S., ballooning to more than 16 million prescriptions for the drugs Clozaril and Seroquel. More than half of those prescriptions, and then you can go back through my videos and see the dangers of these drugs. In nursing homes, antipsychotic drugs have been increasingly used to treat psychosis and other behavioral problems caused by dementia. They're used to keep people quiet. That's what they're used for. But they've shown an increased risk of death. Increased risk of death in patients who take these drugs. The ADHD debate. The subjective nature of ADHD symptoms, along with varying reports about children's behavior from parents and teachers, has made it difficult for researchers to untangle the reasons for the increased diagnosis of ADHD. Stimulants and mixed amphetamine salts generally have been safe and effective. Really, you can't even prove that ADHD exists, but you can prove that something has been effective in treating it. Doesn't make sense to me. Expanding prescription privileges. Some mental health professionals support granting prescription privileges to appropriately trained psychologists. So these people aren't even physicians, but they want to give psychologists the ability to prescribe drugs. Okay? These people aren't physicians. They don't deal with medicines. They don't deal with physiology. They deal with philosophy. And people want to give these people the ability to prescribe drugs. That's absurd. Moving on. What is pharmacological torture? Well, it's the use of psychotropic or other drugs to punish or extract information from persons. This takes place in all psychiatric facilities. The aim is to force compliance. Remember, non-compliance is considered a mental illness in the United States. Keep that in mind. Which could be in the form of pain, anxiety, psychological disturbance, immobilization, or disorientation, and this is what these drugs cause. One form of torture involves forcibly injecting a person with addictive drugs in order to induce physical dependence. And remember, these psychiatric drugs all form a physical dependence. The drug is then withdrawn, and once the person is in withdrawal, the interrogation is started. They don't care to interrogate you, they just want to torture you in these situations. Now, this is alleged use. Brazil, Iran, Romania, United States. The United States in a series of hearings, with the MK Ultra, yada, 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 You read this on your own in Uruguay, Chile, yada, yada. Moving on. So with me, I was wrongly accused of things based on YouTube content by my therapist, by her supervisor, and by the staff of LenapeValleyFoundation. Now, in the USSR, they called this sluggish schizophrenia. And this was due to me not adhering to the same social norms as my therapist and as of Lenape Valley, which is anti-white and pro-LGBTQIAP. So sluggish schizophrenia was the most infamous diagnosis used by Soviet psychiatrists. Development of the theory. The term sluggish schizophrenia was introduced in the Soviet Union by Dr. yada yada yada. Use against political dissidents, which is happening in this country. Psychiatric diagnosis, such as sluggish schizophrenia, was used in the USSR for political purposes, as it's being used in this country now. But they're not calling it sluggish schizophrenia. They're calling it bipolar disorder. They're calling it ADHD. They're calling it bipolar disorder. They're calling it regular schizophrenia. They're calling it whatever they want to call it. But it doesn't really matter. Peter Breggin points out that the term sluggish schizophrenia was created to justify involuntary treatment of political dissidents. In this country, we don't need sluggish schizophrenia. They just use actual fake diagnoses. Premises for using the diagnosis, you can read this on your own. Is mental illness really real? Well, let's hear what a professor of psychiatry has to say.
Upon life is a veil of tears, that's a Catholic expression, and you wait until you die and then you'll be happy in the afterlife. That was the whole idea throughout human history until the last 50 years in America. In Eastern Europe, I don't think people expect to be happy like here.
In Eastern Europe?
Yeah.
Eastern Europe's been under communism for...
Right, they expect to be free.
Quite a few years.
Not happy.
Right.
See, freedom gives you the opportunity to be unhappy and not to be molested for it. I look upon the mental health profession today as a gigantic apparatus of molestation.
Molestation? That's a loaded word.
Yeah.
How do you mean it?
Intrusive. Intrusive. The average person doesn't know how to resist mental health help. Look how much of it is directed to the three helpless groups: children, old people, prisoners. Prisoners are full of psychiatric drugs now. Right?
They go to jail for drugs.
They go to jail for drugs, and then they go to jail for the drugs they like to take, and then when they're in jail, they are forced to take the drugs they don't want to take. That in some ways characterizes the American drug scene today. The drugs people want to take are illegal, and the drugs they don't want to take, psychiatry forces on them.
Let's hear this again.
And the mental health profession, for thousands of years, people looked upon life as a veil of tears, that's a Catholic expression, and you wait until you die, and then you'll be happy in the afterlife. That was the whole idea throughout human history until the last 50 years in America. In Eastern Europe, I don't think people expect to be happy like here.
In Eastern Europe?
Yeah.
Eastern Europe's been under communism for
Right. They expect to be free,
quite a few years.
not happy.
Right.
See, freedom gives you the opportunity to be unhappy and not to be molested for it. I look upon the mental health profession today as a gigantic apparatus of molestation.
Molestation, that's a loaded word.
Yeah,
How do you mean it?
intrusive. Intrusive. The average person doesn't know how to resist mental health help. Look how much of it is directed to the three helpless groups: children, old people, prisoners. Prisoners are full of psychiatric drugs now. Right?
They go to jail for drugs.
They go to jail for drugs, and then they go to jail for the drugs they like to take, and then when they're in jail, they are forced to take the drugs they don't want to take. That in some ways characterizes the American drug scene today. The drugs people want to take are illegal, and the drugs they don't want to take, psychiatry forces on them. And the mental health profession does not complain about this. On the contrary, it supports this.
His most controversial theory, summed up in the inflammatory title of his most famous work, The Myth of Mental Illness. Central to Satz's thesis is that the phrase mental illness is simply a metaphor for human suffering. Modern psychiatry, in his view, represents the medicalization of human suffering. And he compares this to historically when non-normative behavior resulting from psychological distress was religionized, explained away with concepts like demon possession, sinfulness, and witchery. Similarly, in modern times, the secularization of the West has resulted in the field of psychiatry taking over where religion left off, in the paternalistic regulation of socially unacceptable behavior. He prefers to refer to the psychological distress that manifests itself in what we would call depression and anxiety as problems in living, arguing that psychiatric conditions are not viral or pathogenic in a way that a bloodborne or organismic disease is. Instead, Satz addresses how the challenges of playing by the rules of socially designed behavioral games can result in psychological suffering and manifesting conditions severe enough to bring an individual, or to have an individual be brought, to a psychiatrist's office. He also says that the emotion-laden behaviors and complaints of psychological pain from individuals in distress is really just a form of bodily communication, when linguistic communication fails to address the problems in living that the individual is experiencing. Satz, with his libertarian leanings, even goes so far as to call psychiatry a coercive arm of the state, as if the American mental health industry is doping people up, just like the world state was doing with Soma in Aldous Huxley's Brave New World. My analogy, not Satz's. Satz also uses the word hysteria a lot. This is a rather reductive term that's not used in the field of mental health anymore, in favor of more precise nomenclature for psychological states that include symptoms of depression, anxiety, and mania. He also talks a lot about malingering, that is, when an individual pretends to be unwell as a strategy for avoiding the challenges of adult responsibility and social functioning. Now, for anyone who has experienced the pain of seeing a family member suffer psychologically, or for those who have lost a loved one to suicide, or to those of us who have come close ourselves, Satz can sound unempathetic at times, to say the least. And it's easy to get lost in these criticisms and miss the brilliance of some of Satz's arguments. Despite the lack of empathy and dismissiveness of Thomas Szasz, Satz is sometimes like an indelicate but firm father, brazenly refusing to accept any sort of medical diagnosis and putting the responsibility squarely back on the shoulders of the individual who suffers. Psychological suffering is a matter of language to Satz. Complaints of psychological distress are actually due to a lack of linguistic skills, when an individual is forced to complain of illness instead of communicating needs and assertively communicating to change one's social environment. This has been repeated in other theories, such as Albert Ellis's rational emotive behavioral therapy, wherein assertive communication skills are taught to the client and communication modeling is performed so that an individual can learn the language skills needed. that can affect their social environment and lead to beneficial mental health outcomes. So Satz isn't all wrong in his theory of language. Also, Satz's theory of game playing and how society makes rules that need to be followed. And when individuals have challenge learning those rules or abiding by those rules, that they need to be taught through psychotherapy. Satz appeals to the therapist on page 248, and I quote, "This implies candid recognition that we treat people by psychoanalysis or psychotherapy not because they are sick, but first, because they desire this type of assistance. Second, because they have problems in living for which they seek mastery through understanding of the kinds of games which they and those around them have been in the habit of playing. And third, because as psychotherapists, we want and are able to participate in their education, this being our professional role." End quote. Albeit harsh at times, and perhaps uninformed about the biological correlates of certain types of psychological suffering that we see around us, Satz's approach can be...
He states that Saz is uninformed. Saz is a psychiatrist. This gentleman, I don't believe, is a psychiatrist. Let me check here. I don't believe he is, but that's actually humorous. But I just wanted people to understand where this is coming from, where Thomas Saz was coming from. And now I'm going to move on. So when I come back, I'm going to talk about the practice of separating American Indian children from their parents in the United States. And then I'm going to talk about how other children are being separated from their families just because the state doesn't like certain aspects of the family because it doesn't correlate with the state's political ideology and social ideology. And that's all right now for this video. When I come back, I'll be discussing the abduction of children by the state, which is part of genocide.